I'm just gonna pay.
Seems like there's nothing to that.
All right. Welcome to the CCP meeting. We do not have, well, we'll talk about this in a second. We don't officially have a quorum, but there's a couple questions in there. Let's go around and do introductions first to get started. Jeff Goldman, the Chief Probation Officer, and we'll go to my left.
Brenda Valente, probation.
Christy Thompson. Oh, sorry. Go ahead.
That's you, Jody.
Jody Tucker, Truckee Probation.
Okay, Christy Thompson, Women's Coordinator for Project Heart.
Dave Mullen, Project Chart.
Sam Brown, Sheriff's Office.
Bob Jacobs, Sheriff's Office, Captain of the jail.
Dana, Greg, Sheriff's Office, Corrections Lieutenant.
Paul Litchfield, Probation.
Jeremy Vance, probation.
Little Keaton, court. Lola McCara, Youth Career Center Advisor at Alliance for Workforce Development.
I'm Rachel Pena with Social Services and right now the Public Defender as well.
Brian Gruber, Health and Human Services Agency Director.
All right, so the next thing was approval of previous minutes, but like I said, we don't have a quorum. Then public comment. So I don't know. Any public comment. I don't know if you guys want to share anything.
We are now CalAim providers. Watch that first of the month.
So ECM.
Yeah. It's not an easy process and a lot of bureaucracy around it, but
Thanks, Jack. Any updates from Alliance that you want to share?
I recently just started, so I'm the Youth Career Center Advisor. I'm helping 17 to 24-year-olds that have some type of barrier. So being justice involved is one of those barriers, and also being low income. And so I'm helping them find work and with supportive services, so we can provide like interview clothing, help with transportation, all depending on the funding. But yeah, we help youth. And then we also, I think, could be Cali providers. We have a hire program helping people that are justice involved also find employment. And we have supportive services through that as well.
Thanks for coming.
Yeah, thanks for having me.
So the next thing is executive committee delegates and attendance. And when I said, with the roll call, there's a few questions. The delegates that I think Linda kind of went through the notes and through emails and stuff like that. The delegates that we have so far are the Sheriff's Office, Public Defender, Probation, Police Department, or local law enforcement, and the court. The question, and Layla, I'll bring this up. The question with the court, and I gave this question to Jamie just to clarify to make sure. The question with the court was that, like, if Tanya's gone, according at least my read of the statute, like Tanya is the delegate because it says the PJ or delegate. And so like the thought of like a delegate delegating that to someone else, like in my at least initial look, it'd have to be the presiding judge, like naming a delegate, I think. So that's the question that's out there for county council. But I mean, at least in my mind, that sounds correct, the way that it's written. The other one, we don't have one for the DA's office, which no one's here right now, and couldn't find one for Health and Human Services. So I don't know if you've ever named one or not.
not yet. And can you remind me process on that? Is it just letting you know? Do
Yeah,
we
yeah.
do something more formal than that later?
On that some more.
Yeah, it'd be Rachel or Phoebe, but
You just name me the delegate. I get two
the
votes.
two of us.
I always need to be here, so feel free to.
So with that, like I said, thought that Dan was going to be here for Alex for the local law enforcement, but he is not. So again, I think that's the other piece of it. And I guess I don't need to remind the people that are here, but the people that are not here, seeing that we need a quorum, Linda goes off of when people accept the invite as the attendance. So we need to make sure that that's accurate, so we know whether we have a quorum or not. But like I said, I probably don't need to talk to you guys because you're all here. But I'll talk to those other folks.
Well, that might be second half.
Okay. And so the other piece, that the next thing that we had that we said that we would discuss this time is the innovation fund. And I know there was some discussion and some ideas about how that moves forward. And so looking back, initially it was a 1 year kind of seed funding to get folks going on different kind of promising practices or programs to see how they would fit and to get them moving in the right direction, and then give us feedback and data as to how well the program operated. But there was also discussion of, okay, let's say the program is doing well, like how does that roll into something that the CCP or someone else potentially funds for a longer term program that supports the work that all the different CCP members are doing. And so there was discussion as to, do we want to kind of relook at that innovation fund and change that, whether that be like a set term instead of 1 year for 3 years, or any iteration of like, we fund it for 1 year and then next year we look to see if we're going to continue funding, if there's like some sort of cap of how long we fund those things, or how we want to do that. So it's not just like, here's seed money. Wow, that's a great program. And now you don't have any more money. Close down that program that we just said was a great program. And so I don't know if there's any feedback or ideas on how we do that. I have to get Angie down here to see where the innovation fund is at right now relative to the amount of money that's in there. And or we had also kind of discussed, is there the opportunity of the initial year is innovation fund, and then we look at funding it from the wider CCP, maybe not specifically the innovation fund, but the other funds that are available in, whether that's money that we have banked or out of wherever that program fits, whether it comes out of probation or sheriff or DA or whoever, wherever that program fits best. So any thoughts?
Wasn't here during the initial discussions on this, but reading back on the previous agendas, I recall there being discussion about requiring sustainability component to where when they bring it to the innovation fund or bring it to the CCP for innovation funding, that they have to kind of explain what their vision is for sustainability. I think that probably would help. It would give the voting members an idea as to, are they thinking long term? Or is this going to be something where we know they're going to come back the very next year and ask for funding? I think it also helps to trigger discussion on that piece, right? Like help generate ideas about how to keep it going. Otherwise, yeah, what do you do? I mean, you want to create a great program and it just goes away because there's no funding behind it. It seems like almost have a responsibility to control that at the beginning. Just make sure that they've thought about it, they've considered all those things, and maybe what do they see as potential future funding? Will it self-fund? Are they looking in other directions? I don't know if that was actually baked into the like charter of the innovation fund, or if that was just prior discussion.
Yeah, I mean, it was discussion of how like in all grants, like usually at the, the last section is the sustainability piece. And it's interesting because the only one I can remember right now, because I think it's the most recent one, was the pause group. And I think the discussion was, well, we'll continue like hustling and looking for more funding, whether that be grants or donations or whatever it is. And like, well, is that an acceptable, sustainability plan? I mean, I understand we'll have to discuss as a group and make that decision as a group as to whether that is or not. So yeah, I mean, it could just be as simple as we ask for a sustainability plan, and we also have consideration that, the wider CCP group could fund things if it's a fit. But it's also, do we want to put something when we put that request out for funding that's a potential option and what that kind of looks like, what the framework for that is.
Would this group be responsible for verifying like legitimacy of things like holding insurance certificates, and stuff like that too? Because like Jacobs and I were even talking about that, like if, you know, even in the pause program, you're going to take and start caring for an animal. What happens if that animal gets sick? What if that animal dies? Who's getting sued? Who's covering that? Is that going to get attached to this group because of those things? Like, I mean, there's just some of those pieces that like, I think legally probably need some review too. That
Yeah, and there was a discussion, that's where maybe Jeremy or something could go run up and grab Angie, but there was a discussion about that. I don't know. She's here. Sorry. With contracting, or I forget who it was with, when we're going through the process with pause of like, no, it's seen as like, you know, like when the county's like, okay, we have these mini grants for like building trails or whatever, but someone gets hurt on their bike on the trail and falls off a horse or something, like they saw it as different. So there was different requirements. That's about the in-depth I recall of it, but I know that discussion was had. I just can't remember exactly like where that line is drawn. And I don't know if it's different between like once that we grant like innovation funds versus like if we sustain the program, you know, like if that changes the dynamic in there.
I remember the first time it was brought up, there was discussion about who was going to pay for long term, because there was, I remember the first presentation, you had two presentations on it, right?
This was, oh yeah.
Yeah, the first one, I remember that came up about they had an animal there that was requiring a lot more extensive care. I think it was needed surgery or something like that. And the question came up, who's going to, you know, who funds that bill? Because they were talking about getting a local vet that would donate their services. I don't know if there was ever any more on it because we didn't fund it that year.
Yeah, there is a breakdown in there. I mean, I think you recall this, I think Carrie or someone brought up like a differentiation of what they can fund through the innovation from what they have to fund through their own fundraising efforts. And that's broken down in the contract. But yeah, I mean, I don't know where that liability is. And with any of these things, like the more we do with the innovation funds and different things, I mean, my selfish part of it is generally it means more work from my staff, you know, relative to managing these things. So the longer that it goes, like if it rolls into something else that we're also, you know, develop some 3-year contract with someone, that's just more work for Angie and other folks to manage those contracts. So the discussion was 1, innovation funds, how much fund is in there. 2, I think we had the discussion with the difference between the grant funding or like having a contract with someone relative to the liability that goes along with it. Like, you know, the insurances and all those things that we normally do with a contract versus like when we have grant funds. I think we had that discussion with them briefly.
With county council
I
or
thought-
with the auditor's office or?
With someone, I can't remember who it was.
I think it was auditor's office. I mean, there's not a lot different in how they handle it. There are some things that they'll allow that they don't allow for a contract potentially, but yeah, it falls under a lot of the same. Like if we're administering the grant funds, it's very similar to the contract process. It's not a whole lot that's that different. And I apologize, somehow this meeting got deleted off my calendar, so even though I was supposed to be here. Sorry about that, you guys.
My question was like specifically like with that pause program, like if they took a dog and they kept it while somebody's in custody for a year and that dog gets sick or dies, like who's responsible for that? Are we responsible for that? Is it CCP? Is the county in general? Like, is that a contract or you just give money for a program to run and go off on its own and do things? And it's like, because it's not like just taking like golf clubs and storing them in your shop or whatever. You're taking a living being that like the family, you know?
Yeah, for sure. And my understanding is PAWS does have, things that they have people sign when they take, they're basically taking ownership of that dog. That's not an animal. That's my understanding of it. So they do have a couple of waivers, things that people sign, you know, with that. So they have that understanding, and that's part of their limiting their own liability ultimately. But yeah, they do have insurance. Obviously, the county requires that as part of the contracting process, that they've got, you know, lots of liability insurance.
Could they sue the county for
Option.
that?
I mean, I think anybody could sue anybody in reality, but I don't know. That would go.
I'm not gonna make any more comments about pets. I've been getting hate mail for the life.
But like it's funding that's coming out of the county budget, so it's gonna go through our contracting processes and use our boilerplate and all the liability and indemnity language that typically is there.
And that would be the case whether we're looking at it as more grant funds or a direct contract, depending on how, you know, I mean, either way, we're going through that same essential boilerplate with.
Regardless of who applies for these funds moving forward, I mean, pause or, you know, golf clubs or whatever it is. I think like the part that I'm trying to get to is, do we want to keep it the way it is, like where we review each year at the budget time, like we want to just do an innovation fund and include some sustainability language, and then tell folks they can come back, you know, if they want to, and try to submit a request for funding that the group will look at for like a longer term thing? Or do we want to change around the structure of the innovation fund to account for that long-term sustainability?
It seems like in sort of the most purest concept of the CCP, like this is a group of leaders that's trying to find innovative programs that we could then fund to implement those programs in the community. But the reality is that the funding that the CCP has access to is already fully committed to really important programs and projects. And so I wouldn't I think absolutely, if you've got a great proposal, they could come back when we're doing our budgeting and see if that's something that rises to the top in terms of funding. But I would really want to limit the expectations of how realistic they are, if that is to get ongoing funding. And I think we should go beyond just say, give us a sustainability plan. I think that should be part of our scoring and evaluating this. Like, these funds are for you to get something started and to think about how it can be enduring in the community. Like, is this buying you time to get enrolled in CalAim, for example, so that it's like a sustainable funding source? Like, we should score on that versus creating 3 new programs a year that's going to feel like a funding cut that we're responsible for when the funding goes away.
I don't know a lot about any of this, but I wonder if when you guys do decide to fund a project, if maybe you have like a sustainability class structure, like, hey, this is how you, because ultimately you want people to be sustainable, right? Like, you want to help them out, sure, you want to give them a leg up, but you want them to be able to do it themselves down the road. But so maybe just having some sort of hey, these are ideas on how to sustain yourself along with the money that you're giving them. So that way it kind of sets you guys both up for success. I could share something, I don't know.
Yeah,
I
I mean, I think some of that is on I think most of it's nonprofits. So I think that's kind of the board's work of those nonprofits to kind of
figure that out,
to think through that process. I mean, the other thing is, and we'll get into budgeting here in a second, but the other thing is there are fund balances in the CCP. Historically, as the economy shifts, the state sometimes comes knocking at the door, asking about fund balances. I know in some of the fund balances, at least that we carry, there are some state audits that have not occurred in years and now are starting to occur. So there's also sometimes of making sure that that fund balance is used in a way that it doesn't get too large that causes, concern for folks wanting to come and take those fund balances back from us. So that's the other piece of it, but that's, the fine balance of making sure that, if the economy changes and we need it for internal operations, that fine balance of having enough fund balance to do that as well as fund other things. So, I mean, my suggestion, given the conversation so far, would be At the next meeting, the next meeting will be kind of the budget request meeting, which I'll get into in a second. And once we have all those budget requests in, and we can kind of do that roll up of here's all the budget requests, here's the fund balances, here's the innovation fund balances, then we can kind of decide how to move forward when we see the dollars on a page. How we want to move forward with that. Does that make sense? Or I hear some heads nodding. And I mean, in the interim, I mean, if you have any ideas, I mean, you can always send those ideas out to the group. But yeah, I think the last piece of it is there's probably never enough needs to go around to all the people that have great ideas to fund and help out this population. And there's probably definitely not enough money to do the heavy lift of keeping all those programs going year round too.
Jeff, before we move to the next item.
Yeah.
Are you one short of your quorum or more?
One.
Okay, I have a delegation in your inbox confirmed,
Okay,
so.
well, there you go.
Yeah.
And I don't know why I need to look at it. I trust them. Huh? You check it.
I am the default designee of the presiding judge, but you know, it's nice to have a document to the meetings.
And like I said, that was just a weird one of where it's like, it's always been telling you here, but like letter of the law is PJ. But anyways, but then the other problem is, I don't know if you've been here to approve all the minutes.
Do you follow Robert's rules?
I tried to.
Okay, so under Robert's rules of order, I believe you do not technically have to be present to vote on the minutes, but I can also abstain, and you still have a quorum.
There you go. It's funny because I did have my little laminated Robert's rules like cheat sheet. It's like, you know, like the chemistry cheat sheet or whatever you get in college. I didn't bring it down with me. All right, let's go back to the minutes so we can get that out of the way because Linda's 3 meetings back on the minutes, right?
3 meetings behind you.
So can I get a motion to approve the minutes of, can we do it all at once? Can I do it all at once?
I think so.
Okay, May 5th, May 15th, and August 14th.
Are we going based on like we're abstaining if we weren't there, or are we following Robert's rules? In fact, we don't roll iron.
I follow Robert's rule.
All right, so I move that we approve the minutes from May 5th, May 15th, and August 14th.
Get a second.
Second.
Any discussion? All those in favor say aye. Aye. Any abstentions? Any opposed? Hearing none. Okay. 8 meetings with the minutes. The next thing is the data group. A couple of updates. First, I'll start out with the Chico training. They kind of fell off the map for a little bit. And for those that either weren't here or don't remember, we had discussed doing a training that's like a data literacy, I guess is the best term for it, data literacy class. And so I reached out to Chico because they have like a data science department. And so they gave a couple presentations and they kind of, I don't know, went on vacation or something. And then they came back and said, yes, they would like to do that. They gave a dollar amount. $3,000. Yeah, $3,170. And what that includes is they could accommodate 30 participants. That's 2 professors and 1 graduate student assistant. And they would go through, I think it's like a half-day training, 4.5 hour total session. And they gave an outline of what that is. And essentially, you know, it's data vocabulary, interpreting or reporting data, thinking critically about data, and asking and answering questions for data. And a little bit of practice on hands-on exercise relative to dashboards and case management data. showing you how you can use it. And so I sent that out to the group and I got positive feedback on it. And so the information I have now, the two questions were how many people they can accommodate. So I answered that 30 and the other of when they could do it. And so basically they're beholden to the school calendar because they're teaching classes. They would like to do it over their spring break, which I double checked is not over the same spring break as like local schools. Theirs is mid-March, so March 16th to the 20th. So sometime in there, they would like to do it. School spring break is like April, the first or second week of April. So it looks clear, I think, for most folks. So the next step would be to contract and get that in place. Small dollar amount, but to get that in place and get that going. And so the other question I got was, oh, would that just be members of the exec committee on CCP? And no, that's not how, at least how I envisioned it. It would be whoever you want to send from your department that benefit from this. I don't know if like someone that's a full-fledged data analyst already would benefit because hopefully they already know a lot of this stuff, but maybe they would so that everyone's on the same page. But essentially it's to get everyone kind of swimming in the right direction since when we had our retreat. That was one of the things that we discussed was data and sharing data and using that to make decisions and common language and that sort of thing. So are there any questions, comments, concerns?
We're trying to narrow down a day in that week.
We can, yeah.
Is this in Chico or is that here?
They're coming down here. You want to go to Chico?
No.
It's on a porch. There's a couch on the front porch. You can sit outside.
Do the week again, chief?
March 16th to the 20th. And so, I mean, you can take that back and then get back to me in the next week or so, because it seems like if I don't, when they're communicating, if I don't lock it down, they go off into disappear for a little bit. So helpful if I've got them on the hook. Any other questions or comments about that? And so the other data growth piece is, so our analyst, Brendan, I think some of you already know this, he left, got a job at PG&E. They paid him a lot more money. And so he is no longer here. And so in the interim, until we find a new analyst, and we're going to, since it's kind of a unique position, it takes a little bit longer, I think, to try to find a good fit for that position versus, the standard kind of entry level position. We have another guy, Mike Wilson, who some of you might know. He helped out with the results first cost benefit analysis thing we did a while back. He does work all over the United States. His last big gig was in Australia. Like, he does work all over the place. But he lives in Nevada County, has forever. I think he said 1930. It's when they lived here. But anyways, he has that's a skill set that's hard to find. He does a lot of work. Usually if it's a two-person job like him and Kevin O'Connell do a lot of projects together. He's just not so much in the behavioral health space, more in the criminal justice space than Kevin. And so he's got some free time given that I think all of his federal contracts were canceled. So he has some free time and he's local and he said he would help us out. So we're working on a contract with him in the interim. And then when we get a new analyst on board, he's going to kind of help us onboard him and orient him towards what needs to be done. And so that's where we're at with that. And part of that is, I mean, he's done a lot of work for Santa Barbara County. So I showed us some of the stuff that he's built for them. And so some of the things that he's done differently we've already talked about some court-related dashboards related to pretrial and some of those things, and fine-tuning some of that stuff, as well as maybe there's some help relative to kickstarting some of the stuff, work on the CCP data group as well. With that, we've talked in the past about the annual plan and whether we wanted to do that. There was some discussion whether that was required now, given that the annual plan also came with kind of the benefit of a planning dollar amount, which was changed. I think it went official. So CC email. Enactment of the budget on June 27, 2025. So I got a letter from BSCC basically saying, with the passage of this assembly bill, this budget bill, BSCC will no longer request or collect CCP plans, nor will the agency provide updated statewide reporting related to the content of those plans. And so we had kind of discussed that we thought that would be on the horizon and that we would go forward with the plan as it stands, just to have some sort of document relative to the things that we're doing. The only thing I would say on that is I think that this opens it up to, we were kind of stuck in their format. They gave a format for the plan. I do think that hopefully with the help of Mike Wilson maybe and other analysts in different departments, that maybe we could change that plan to be more of like, these are the things we fund and these are the outcomes of those programs. And there's some examples from other counties that do reports like that versus a lot of the stuff that the state and the legislature wanted of like, you know, to me seem more kind of fluff stuff of like, this is evidence-based supervision and these are the things that go along with it. But more so of like, this is what we're doing and these are the outcomes of what we're doing, to make kind of drill it down a little bit more. Because like I said, we're not beholden to do the plan in that format or submit it to any state entity any longer. So any questions, comments, concerns, anybody? Matt? I can send around some examples of other counties that are, it's kind of more of a, you know, state of the union kind of report, and that kind of prefab report.
Discussion item for next meeting, what's our, like, you're gonna send around examples and then we're gonna decide if we wanna even do a new plan or, so if we wanna utilize that flexibility, that's the.
Yeah, I mean, it's all of the above. It can be that, or you could say right now, no, I really love that plan and please don't change it. And again, like the selfish part is we put that plan together for the most part. Yes, we get input and people send us documents and we cobble it together, but like, that's kind of a heavier lift for Paul's unit to kind of put that stuff together. So if we could change it, that would be helpful. I mean, especially since we didn't mind putting that together in the past because we were the beneficiaries of those dollars that came in as well. So.
And to clarify, the dollars have gone away or just the requirements of the format have gone away?
Both. So basically what happened was when they took it out of the budget, that triggered them re-looking at it of, can we require it now because we don't pay you to do that planning part? And so they've realized they cannot, so.
Would be supportive of developing a framework that's useful for this group as opposed to sticking with what's been done.
Especially if that realizes efficiencies, given that there's no longer funding.
Any other questions, comments on that? It's on here. I put CalAim updates. I mean, there's permanents welcome to give updates. Our update is, I think we've said this, maybe not in this group, maybe we said it in the CalAim group, but there was also funding available for probation. Initially, we said we didn't want it. because it focused mostly on juvenile stuff. And we just, I guess, didn't want the strings attached to $1.5 million that they wanted to give us for our ADP of one. And so they kind of pushed back. Eventually, we decided to take it. They gave us some ideas of how we could spend it. And then we submitted our plan, and then there's no rhyme or reason to some of the questions they've asked us relative to the plan. Because, like, for example, I mean, I can bring it up as proof. Like, for example, they approved the North San Juan Community Center stuff, but they didn't approve Common Resource Center stuff, saying like what's in custody and what's out of custody. But those two things seem, I don't know, fairly similar to me relative to the clientele that they would serve. So we did have a meeting with them fairly recently, and I kind of pushed back on them of like, how does this benefit rural counties that have these low populations that are already doing the thing that you want the end goal to be? Like, if you want people to be served in this way, basically we've already realized a low ADP and all these other things, and we can't recognize this like economy of scale like other counties can, of like, because their example is like, we'll set up a program. It's like, we're gonna set up a whole program for one person. And so they decided that they will go back. We haven't heard from them yet. They understood our concerns, and they said they would go back to their county, or not county council, but their council relative to the requirements of the funding to see if they could get it waived for us or a special accommodation so that we can use it for those things. So.
Did they give any kind of timeline?
No, they're not the quickest. And it's interesting because they have a group, like, I don't know where they are, New Jersey or something, that's like, Boston, that's like reviewing the plans, but then it's also with state folks, you know, so it's I mean, you guys probably know this, but it's like people in Boston that defer to the state people and then they defer back to the other people, and it's just, you know, no one makes a clear decision, so.
We still have the same timeline for spending that?
Well,
money?
that's the
Because
other- that's-
crazy talk. Yeah,
That's what's stressing out Angie.
I mean, for real. I mean, less stress and more like it's
Possible.
That's just not gonna be a thing there. I mean, especially with some of the things that we were asking for, right? San Juan Community Center, they already needed the full amount of time in order to be able to get those upgrades done.
Yeah.
Paid for.
And it doesn't make, like, they asked us, well, why did you ask for a car? Sheriff's Department got money for a car or something like that. And it's like, but we're not the Sheriff's Department, and the car is not going, it's going to the juvenile hall to pick up kids. Oh, okay, thanks for clarifying that. And it was just like, I didn't think,
We got a car, but yeah.
they said that in the thing. They said something about the
I
sheriff.
think they confused us with the sheriff's department, like it was kind of all over the map. It was strange. We haven't yet decided how confused they were with that.
Anyways, I don't know if you guys have any CalAim updates that you want to share.
Go ahead. Yeah, our one quick update is that we're technically live with CalAim now as of November 1st. Really what that means is that we're eligible to start billing for CalAim services for the IPs. We're not doing that yet because we're still figuring out the particulars of the contract with the third-party biller. Anybody's ever tried to hire a third-party biller for insurance billing, it's a nightmare. My wife did insurance billing for 2 decades. Right now, they're trying to determine what their profit margin is even going to be. So we've been discussing a flat rate mixed in with a percentage because we have to make sure we make it a motivation for them to work hard. Because if we just give them a flat rate, where's the motivation to work hard? Always going to make that amount of money and not have to do anything. So we had to negotiate that in. We thought we were at the finish line with them, and then they shot back after their council got hold of it, shot back a whole bunch of red ink all over it. And so our 2 in-house experts on CalAim have been going through it. We're hoping to get that finalized soon so that we can actually start billing, but we're still going to have an implementation period because software systems have to talk to one another. Fortunately, CalAim does allow a look back period for billing, so we're not terribly concerned about it. As long as we get that going in the next month or 2, we should be able to cost recover everything back to November 1st. But a lot of it is still yet to be seen, right? A lot of this was theory, and I think you touched on it, that you ask questions and they don't necessarily give you an answer. They barely acknowledge that they understood your question.
Yeah.
It's been a lot of back and forth. I mean, it was essentially building an airplane in flight. And I don't think the state necessarily appreciated what we do versus what the intent of that program was. And so they've had to modify that program in a number of ways to really fit the actual need at the end. So a lot of it's still yet to be seen. We're pretty early on in the process relative to a lot of other counties that haven't even gotten anywhere close to where we're at. So a lot of it's just going to be learn as we go and make adjustments if needed. But it was exciting to finally get the email from the state that said, you're approved to go live. We were supposed to be October 1st, and then I don't know where we got the email saying November 1st. So again, just the left hand not talking to the right hand.
Yeah.
But still moving forward.
Did we get through the pay for?
No. Yeah, so that's a whole other discussion.
So if you guys haven't or whatever, anyways, there's a website for the simplest of terms. They forced us to use a personal social security number to get in there anyway. Did that. So one of our lieutenants opted up, put their social security number in. And ultimately, then as we named it under the Nevada County Sheriff's Office, they're like, you can't do that. It has to be Nevada County. You guys already have your account. You guys need to be under this other bigger thing.
Love that.
It's fun.
Yeah.
No, then
We followed their direction, and then the other department told us you can't do that. And now we're stuck, and we're being told that you potentially have to reapply, and the initial application took 4 months to hear back.
the state's been horrible. When we met with them originally, we went over our plan and we were like, hey, this is where we're at. They're like, well, you didn't do this. And so Molly would be like, no, it's under 7B or whatever. They're like, oh, well, we didn't read 7B. This other department read 7B. Like, so what are you like, bring 7B over here and have them? It got really frustrating. And so they'd be like, well, you didn't include this in your plan. It was like, no, it's in there. It's just not where you want, like where you're looking. Like, so you have to almost like duplicate the whole thing. It's been really frustrating. So to get live was a big deal. I will say the agencies that did go live before us for law enforcement, it's because they either have public health or behavioral health doing their CalAim stuff for them. So to go from scratch as a law enforcement entity, I don't know that anybody's ahead of us. In fact, Santa Barbara, San Luis Obispo, who has a chief medical officer that oversees their contract, they're still not live. And they have medical professionals running their program. So
Congratulations. I know that was a huge impact. What you're describing has been like the experience with CalAim and DHCS throughout, from the earlier initiatives through present. So that's been.
I talked to Phoebe, she told me it was normal. So
Yeah.
it didn't make me feel better, but
I think everybody there is very well intended. It's just people are so siloed.
Yeah.
They just don't want to see past their silo until it's forced upon them, and then it works.
It's
a lot of headache. That's a good way to say it.
I think that extends to the like biggest picture as well, like the whole initiative. There's like good intent behind it, and that, like you mentioned, they don't know what counties do. Like that's been the experience from throughout, where they're learning as they go and adjusting things. And like update on sort of the federal level, like there's been a lot of concerns around whether the waivers and legislation that authorize CalAim will persist with federal changes. And I'll just say that it's enormously like complicated. There were
the 1108 waivers. Like
that's 1115 waivers are what they're called. So the Medicaid program allows for programs that are outside of the normal Medicaid rules and regulations, and outside of the agreements that the feds have with each state. And you do a waiver that allows you to sort of experiment with something. And so parts of CalAim are built on those waivers, parts aren't. And it's like extremely convoluted, like which pieces relate to waivers that are expiring. Some of them are expiring in December of 2027, 6, and some of them, I think the justice involved was just approved late in the Biden administration. So that one persists more towards the end of the Trump administration. And then like there's all kinds of pieces, like apparently ECM will continue even without those waivers. Most of the community supports will continue, except 3 of them are contingent on waivers. So it's just like, and I have no idea, like the jail-based billing, like whether that's connected to a waiver or state contract with DHC, with CMS or what. So that's information starting to trickle out around that. And so I think we'll begin having more clarity.
So as soon as you're done, it'll begin.
or it never starts.
No, we know it's a reality. It's a lot of work potentially.
It just
go away.
It just wasn't like well thought out. The one thing that we get frustrated about, at least from law enforcement, and because this isn't the first one, I felt like they did it with like the the 24/7 crisis response and stuff like that is that it seems like the state medical decides that law enforcement isn't a good partner for those kinds of things. And it'd be nice to just be brought to the table, or at least like associations that represent like the larger law enforcement entities be brought to the table. Because there's a lot of them and there's good intent on both sides. It's just that it comes out to this, like, law enforcement's not good in this situation. And then you have a bunch of crisis workers that don't want to go out to a call by themselves because it's dangerous. So I just feel like the state could do a better job. I guess we all feel that way. No offense, I'm sorry. State people in the house, the courthouse is much smaller.
You're neither state nor local, we're right in the middle.
Makes you feel any better. CDCR is supposed to be doing this work and sending that information to us when they release something. Remember the email I sent you the other day?
Oh, yeah.
And no one in the state has seen anything from CDCR until it gets released to do that warm handoff to probation or anywhere local when they get released. So they said, like, when Gapo or whoever comes to the meetings always says, this is happening. It's not. Anyways. So the next thing, I mean, I didn't put it on here, but the roundtable piece. In the bylaws, it says budgets or requests, funding requests will be in 2 weeks before the first meeting of the year, I think. Is that right?
Yeah, generally around the first of the year is the deadline for the request, so I don't remember. I
Yeah,
don't know when
like
our meeting is scheduled. but-
January 22nd. So yeah, somewhere around there. So after this meeting, normally there's an email that goes out that has like the timeline broken down and like the attachments and stuff. So we'll send that around to all the execs and delegates to fill out those budget requests. And then so at the next meeting, we'll have those, we can discuss those. In the 2 week periods, just so that people have a chance to look at them before the next meeting. The last few years, they've been pretty much status quo. So I don't see a whole lot changing relative to those requests, but maybe.
When did you want those, Angie?
So you said it's on the 22nd.
Correct.
So 2 weeks before that would be the 8th of January.
So any questions about that process? And like I said, there is a kind of a template email that we've sent out the last 2 years, I think, that has all the different timelines and when you have to get settled. And yeah, so, and there's always, I think sometimes there's confusion. Steve's usually the one that sorts through this, but
That's why there's confusion.
there's usually some confusion as to like who fills out what request. And so sometimes some come from behavioral health, some come from social services and whatnot. So it's that piece of it of making sure the right people know who fills out what request. So we'll try to make sure that that's clear as well. So. Any questions on the budget requests? And I don't know, I mean, if we have any projections on dollar amounts or taken yet.
I don't have that with me in this junction.
Do we have it yet that we can send out with email or not?
Check, I don't
know if it's on that last sheet they would get from CPOC with all the different ones.
they don't include that because it's not a probation specific funding source. So they haven't included that on our. So I don't know if I've seen anything, any estimates for.
I haven't heard anything bad, so.
January budget is usually where we.
Right, yeah, I'd say I don't think I've
That's about it.
pre-quills to that. No.
So,
Maybe this is premature and it should be a discussion next time, but you mentioned the fund balance that's built up. Is that coming from overly conservative budgeting? Is it coming from underspending for the funded programs?
Both, I would say. I mean, I think, for quite some time, historically, obviously, we wanted to make sure we weren't, because most of what we funded is just ongoing expenses for the, departments involved in it. And so I think we've, for so long, because it can be a potentially unstable funding source given the, economy, we've been holding back in that. And then, yes, it does seem every year, every department comes in under budget for whatever the reason.
Because the last couple of years, we've budgeted over the yearly
Right.
amount. And we calculated out how long it would go into
Right.
fund balance, but then when the billing comes, it doesn't go into it. So
It's like that's our discussion.
And that started primarily like during, or got exacerbated when Nevada County went to ODS, right? Like where we really started saving some.
Yeah, well, that impacts very significantly. Treatment dollars were not nearly what they used to be.
The probation budgeted treatment dollars, because that's Medi-Cal available and can go through the behavioral health system.
that's one of the most, I mean, not that a ton of people are clamoring about the CCP budget, but that's the most frequent question I get of why are we spending more on treatment. And I mean, it's like that around the state. Lots of people did spend a lot more on treatment, and then when more treatment was covered, then they didn't spend as much on treatment because they were maximizing those dollars. So. But yes, some counties, again, that can stand up larger programs themselves do spend money on those things, but it's like they have a whole like building in a center and all this other kind of stuff to do it.
Just don't have a lot of programs available in Nevada County.
More than most small counties, I would say. Any other budget questions? Okay. Anything else? This is the roundtable portion. Anything anyone else wants to share? Paul, you look like you wanted to share something. No? Right, if nothing else. I get a motion to close the meeting.
That motion.
Can I get a second? Any discussion? All those in favor, say aye. Aye. Opposed? Motion carried. Thank you.
Events.